It's hard to pinpoint one thing that I love most about my job. To have that feeling like you've helped a child fix something that they couldn't do before or learn a new skill, there's really not many feelings that make you feel as good as that does. The goal at Kidz Therapy is to help every child maximize their potential to succeed.
We want them to be able to complete their homework independently, get themselves dressed independently, and most of all, be able to succeed at school.
To help give them the tools that they need to be successful human beings down the road, and also help them celebrate the achievements that they make along the way.
We like to do two things when we work with patients here. The first thing is to form a partnership with the family, both the parent and the children, to let them know that we're on their team working with them to improve their children. The second thing we like to do is to have tailor-made specific therapy protocols for each and every one of our clients. Clients can have similar needs and issues, but require different approaches and different ways of working with them to improve them.
Every child comes in and we give an assessment based on their needs, and I don't just look at speech and language. I look and see if there's any other things that might be going on that may be affecting the speech and language skills. And then once we do all of those things, we come up with a treatment plan cohesively to incorporate any other needs that they might have in addition to speech and language.
The different types of assessments that we provide here at PSI are just a range of assessments, from intellectual assessment, visual perceptual, visual motor, social emotional behavior, personality, memory, and auditory processing are really the main ones we focus on. There's also more specific things depending on the client's needs and the referral question that we're actually addressing.
We offer a variety of treatment options for the children under our services. We provide psychological related services, and that would include counseling and various types of psychotherapy techniques. We provide family counseling, we provide parent training, we provide social skills training for the children. We also provide various neurotherapies. These are stimulation or exercise therapies to improve cognitive functioning, thinking abilities in the child, or attention abilities in the child. We also have an array of other health-related services that are integrated. For example, we have speech therapy, we have occupational therapy, we have physical therapy, we have nutritional and biochemistry types of assessments and nutrition interventions, dietary interventions for the children. We have in-house physicians who can prescribe, if absolutely needed, to help with medication or to help the children get off their medication safely. So we also have educational consultation services, tutoring services. All of these services are worked as an integrated team for each child, tailored to the particular needs of the child.
The benefits of a child or patient coming to this clinic to receive therapy are that we have a multidisciplinary team, a lot of treatment options, and we offer some safe and effective alternatives to standard medical care that offer more long-term and effective solutions.
We're really trying to reduce stress for the family, principally by making all of the services available, or as many of these services available, under one roof in one location. So on any one given afternoon per week, a child can get their speech therapy, their mental health services, their nutrition services, whatever is needed in one place at one time without having to make multiple visits all week.
Most children have the opportunity to practice and refine skills that they are struggling with in a safe environment. So we can work on giving the parents resources for home programs and ways that they can adapt different sports and activities that their child can be successful in to participate in their community. So we'll work on strengthening and balance and lots of different sports activities, and the idea is for all of this to be carried over at home so these children can be more successful.
We then provide those treatment modalities, and we then subsequently follow up with additional assessments or repeat assessments in the course of therapy to show that the therapies are actually working the way that we intend for them to work. Once the goals of the therapy have been achieved, the child is then has a final assessment to verify that the goals have been met, and we are able to then discharge the child from service.
We see a variety of different patients, and some including autism, learning disabilities, and Down syndrome.
We have served kids as young as 4 and 5 years old, and we've also worked with people as old as 75 years old.
We treat and are experienced with all age ranges, from infants to 60 plus. So we're all trained and comfortable with working with a variety of disabilities and ages.
I enjoy most about my job is seeing children come in and progress through their treatment and see them grow and become more independent in their skills.
To see clients 6 months, 1 year, 2 years later after we've completed therapy, and to see and hear the difference in their children's lives.
There's not many people who can say that they start their day every day with a child smiling at them and bidding them farewell. I love what I do. I love watching kids succeed and learn things. I love watching them celebrate their own achievements. And I love the fact that I feel like I'm making a significant difference in their life.